Hey guys, it's Heather. I just wanted to do an update for you all about how my next semester in nursing school has been going. Basically, I've just been doing clinicals, and I also had 2 tests and a check-off. So this video is really going to focus on the testing that I've experienced so far and just some general tips and tricks. Just test taking strategies is really what I'm trying to say. But just a little bit of info. So we had a test over IV skills, our IV checkoff, and then just our general lecture test. So the IV checkoff went great. I passed. It's funny because I was really kind of nervous about diluting IV push meds. We didn't do IV push meds really at all in my LVN program, so that was like a completely new skill to me. And so I was just kind of confused because we were told a couple different ways of how to do it, and so I just was really like, I hope I just get a med that I don't need to dilute, and so I don't have to worry about it, and I can kind of do that in the clinical setting based on that facility's policy rather than worrying about which way that particular teacher that's checking me off is going to prefer. So anyways, I ended up getting Protonics as my med that needed to be pushed. And if you don't know, which I didn't, Protonics needs to be diluted in 10 mLs of normal saline. And for our checkoff, I don't know if it was a thing for the checkoff, but it was saying that the dose needed was in 5 mLs of solution. So I had to draw up 5 mLs of the solution and dilute it in 10 mLs of normal saline. So it was a total of a 15 ml IV push, which is a lot of a lot of fluid for an IV push. So yeah, they always would say that you're going to get the thing in checkoff you're most scared of, and that definitely happened to me, but I passed just fine. No issues with that. And then our IV test was actually, it wasn't hard, but it was harder than I thought it was going to be. I thought it was going to be like really knowledge based, like fill in the blank, like, say what these certain acronyms mean, like match up definitions and stuff like that, because that's actually kind of what the teachers made it seem like. But it actually was 25 multiple choice nursing style questions, like, your patient does this, what do you need to do, what signs and symptoms, like what do you assess, blah blah blah. And then one question at the very end was putting it in order of the steps to start an IV. And so I did great on that. But the main focus of this video, the fuel behind it, is my lecture test. So our lecture test was over musculoskeletal disorders, some neuro disorders, intra-op, and my mind's going blank. Some cardio stuff, coronary artery disease, and MI. So I felt very well prepared for the test. I felt like I really knew my stuff, and I'm taking the test, and there's a few questions I'm kind of like, I'm not sure. But when I get to the end of the test, I have a very methodical system that I used all through the LVN program, and that I will always probably use for these kind of nursing tests. Once I get to the end, I have gone over all of the questions a second time to make sure I answered all of the questions and that I answered the right answer that I wanted to answer, if that makes sense. If you saw our tests, it would make sense to you, because it can be really easy to choose the wrong one with just a simple extra mouse click or something like that. So anyways, so once I've done that, once I've done that, then I go through the ones that I am really unsure about, and I go through them as many times as it takes until I feel comfortable with my answer. So I did that, and I finally narrowed it down to 5 that I just really wasn't sure if I had the right answer or not. Everything else I'd say 99% sure I had right. So I'm expecting an 88, a 90, something like that. Maybe a 92, which the 92 would have been an A, and the other 2 would have been a B for my particular nursing program. And I pull up my grade, and all the blood rushes from my face. It was not what I was expecting at all. I made a C, and needless to say, in that moment in time, I was devastated. So I really had to analyze what I did wrong. I didn't make, perfect grades on every single test in the LVN program, but this one I just really was blindsided by. And I just realized I got really anxious, first of all. I didn't go with my gut instinct. I tried to rationalize it in my mind differently, and I tried to think too hard about the question and not using exactly what the question was asking and using that to answer. I tried to put in real world situations, and that's not what you need to do for these nursing tests. You need to look exactly at what the question is asking you, think about what you've learned in lecture, and then apply what you've learned in lecture onto that question. Not thinking about specific instances or anything like that. You need to just only think about what they are asking in that particular question. So at first I was mad. Then I started thinking more about what I did wrong, and I just realized, like I told you, I did those things wrong, and these nursing tests I still passed. That's great. You know, that's all you can really hope for in general, but I'm a perfectionist and I want to do better than that. I know that I'm better than that, and I'm capable of better grades than that. But anyways, so I've really got, some work to do on my own behalf for my own personal, self to improve my performance and my grade in the RN program. But anyways, I just wanted to share with you guys some, trying to get my little thing ready here, some tips that actually our nursing instructors gave us on test taking strategies, and these were somewhat similar to the ones that I found in my Kaplan book that I used to study for the NCLEX. But one of these in particular, I really noticed when I went back over my test would have helped me if I had known this particular strategy. So one of the first ones that they talk about is priority words, and that's something like, they're just things that should call out to you. Like one of them is like, what would be your initial action? And that's a question that's probably going to have all four of the answers are probably right. They're things that you're going to need to do as the nurse. But which one are you going to do first? And that can be really hard, but that's part of that prioritization. Another one can be, how, like you get a lot of surgery questions, like how many days post-op? Did they just come back from surgery? Are they 2 days post-op? That can really help put you in the mindset of where this patient should be at, thus far in their recovery. Early sign versus late sign, that can be really different depending on what disease process you're talking about. Like, for instance, today we were learning about TB, and so early symptoms of TB, nothing. They're asymptomatic. So if the question asked me something about that, I would need to know, okay, these are probably all signs of TB, but which one's an early sign versus a late sign, such as, like night sweats, fever, all that stuff. Which would be a more, that the disease has progressed further than that. So. Another one is false words. And this is kind of tricky because it's basically saying that your correct answer is the wrong answer, if that makes sense. So it's like, which one of these, when you're doing patient teaching, indicates that the patient needs further instruction. And so they're most likely going to give you 3 correct answers and 1 wrong answer. But in that particular instance, you need to pick the wrong answer. So that's really important to pay attention to when you see something teaching. Find out what they're trying to say. Are they trying to say that you're assessing the patient's knowledge, that they know what you are teaching, or that they need an additional help to understand? So like I said, they're going to give you 3 options that are right, that this is what the patient should know, but then based on what that question is asking, they're going to want you to pick the wrong answer, and that's actually the right one. That's going to say that this patient has a knowledge deficit and they need you as the nurse to help. Another one that was mentioned was hints. So it's basically telling you that, like, there can be certain phrasing in the question that is going to match up with certain answers, and that should help trigger your thought process as to, this could be, and this is not always the case for this one, but this could be the answer. So like for instance, if they say in the question something about like, it's kind of testing your knowledge. So they're going to say something to you like, patient is NPO. This patient understands the teaching based on them saying that, I will take nothing by mouth. But then there's going to be other options of like, oh, I can have ice chips, blah, 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 blah. And that's something that kind of coincides, like I said, with the teaching one, like the one I just now mentioned. But this one is just saying they want to see that you understand what NPO means. And they could do something like that too, where they say like hyponatremia. They want to see that that, they might need to increase their sodium intake because they have low sodium or something like that, So they're kind of hints as to say like, think about what this question is really asking you. One of the ones that I found was really, really helpful, and this one actually really helped me for the test, was answers that are similar. We had a particular test question that asked, what would you do first for this patient? But two of the answers were give pain meds. One answer was take them to x-ray, and then the other one was to wrap their leg and apply ice. And my gut told me that the answer was to wrap and apply ice. But the question also mentioned the patient was in severe pain, so I'm thinking you need to medicate them. But then there are two answers that say pain medicine, so how do you know which one to choose? Well, I wish I would have known this at the time, is you don't choose either of them. They're too similar. You can't choose between the two. You don't have enough information. So in that instance, I should have gone with my gut of you need to wrap and apply ice. But the severe pain kind of, tripped me up a little bit. And then also the fact that there were two options. That should have triggered something in me immediately, but it just didn't. So that's something that I really found helpful after reviewing my test that I'm hopefully going to be able to apply to further tests, is that if you have two answers that are really similar, they're most likely neither of them are the answer. And then you can hopefully deduce from there that there's going to be one that stands out as the best answer. Is that care should always be focused on the client and on the client's needs. So if they have some kind of a question where you're needing to give some kind of like therapeutic response or something, that's usually the right answer of that answer needs to directly coincide with what that patient needs. It shouldn't be deflecting their needs. It shouldn't be focusing on somebody else. Like one of the questions could be, oh, this patient had a diagnosis of cancer. The patient's husband was really, unsupportive and left the room. And so you wouldn't want to go, one of the answer choices could be something like, go find the husband and talk to him about his feelings about it. But no, the husband is not the patient. You want to have focused care on the family, but in testing questions, they want you focused on the patient. So the better answer in that situation would be find out what that patient feels about their husband's comments about their new disease or diagnosis or whatever. So that's something to really keep in mind, is to always focus on the patient. That's the number one thing. That's 99% of the time going to be what the question is really asking you. Another one that's pretty well known is absolute words. If you have an answer that says always, never, they will do this, they won't do this, that is usually always not the correct choice, because nothing is for sure in every person. Nobody will always do this. Nobody will, have to do this a certain way, blah, 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 blah. Those are usually the incorrect answer. So those ones I feel like are pretty well known. I've kind of always known that one, but that's just like a huge one. Like if it says always, never, none, something like that, that's always going to be the wrong answer. I think they gave one example though, saying like there are a couple of exceptions to the rule, like the nurse will always identify the client before giving any kind of meds or doing any procedure, or the nurse will always provide safe, competent care, stuff like that. But that is kind of obvious, But when you're in a general answer setting, it's not so absolute like that. Yeah, basically, just really try to go with your gut. Do not change your answer. I don't know how much I can stress that. I didn't change any of my answers this time, but I have definitely changed answers before, and I've gotten them right on the first time, and when I changed them, I got them wrong. So do not change your answer, guys. Anyways, I hope everybody's having a really good semester so far. It's definitely been crazy and stressful, and I hope to have, more experiences and a better test outcome next time. But you know what? I'm just glad I passed. I know a lot of people struggle throughout nursing school, and I've been very fortunate that I've had an okay time with it, but it definitely doesn't make it easy to make, grades that you're not okay with. So anybody else out there that's struggling, I definitely feel you. I understand, and it doesn't necessarily have a direct correlation with your knowledge level. I feel like I know a ton of stuff from that lecture test, and my grade just does not reflect it. So I definitely understand how you feel. But anyways, guys, thank you so much for watching. Thank you for sitting through this long video. I hope you found it helpful. I hope I didn't ramble too much. And if you guys have any questions or would like any other, video requests or anything like that, just let me know and I will try my very best to do that. Anyways, I'll talk to you guys soon. Bye.